Thalidomide. The very word sends shivers down our spines, conjuring images of a pharmaceutical tragedy that shook the world. Introduced in the 1950s, it was initially hailed as a wonder drug, a safe and effective sedative for pregnant women suffering from morning sickness. Little did anyone know that this seemingly innocuous drug would soon unleash a global health crisis of unimaginable proportions. The promise of thalidomide was as bright as the smiles of expectant mothers. It was marketed as a non-addictive alternative to barbiturates, offering relief from nausea and anxiety without the risk of overdose. Prescribed widely across Europe, Australia, and other parts of the world, it quickly gained popularity as a safe and effective treatment for pregnant women. However, this idyllic picture was soon to be shattered. The world was oblivious to the dark side of thalidomide, a teratogenic monster lurking beneath its harmless facade. Unbeknownst to all, this wonder drug interfered with fetal development, leading to severe birth defects in thousands of children. By the early 1960s, a horrifying truth began to emerge. Hospitals around the world reported a surge in an unprecedented number of babies born with severe deformities. These infants, tragically impacted by thalidomide, suffered from a range of conditions collectively known as phocomelia. Phocomelia, meaning seal-like limbs, manifested as short and internal organs. These children faced a lifetime of physical and emotional challenges, their lives forever altered by a drug meant to ease their mother's discomfort. The world watched in horror as the scale of the tragedy unfolded, with an estimated 10,000 to 20,000 children affected worldwide. The impact of thalidomide extended far beyond the immediate victims and their families. It sent shockwaves through the medical community, casting a long shadow of doubt on the pharmaceutical industry and its practices. Amid this devastating crisis, a beacon of hope emerged in the States. Dr. Francis Oldham Kelsey, pharmacologist at the Food and Drug Administration, played a pivotal role in preventing the widespread use of thalidomide in the US. Despite immense pressure from the drug company, Dr. Kelsey stood her ground, demanding more rigorous testing and evidence of the drug's safety. Her unwavering commitment to scientific rigor and her deep concern for the well-being of patients prevented countless tragedies on American soil. Dr. Kelsey's heroic stance became a defining moment in the history of drug regulation. It led to the strengthening of the FDA's authority and the implementation of stricter drug approval processes, ensuring that new medications undergo comprehensive testing before being made available to the public. Thalidomide's redemption, a new beginning. For years, thalidomide remained synonymous with tragedy, a stark reminder of the devastating consequences of inadequate drug testing. However, in a surprising turn of events, this once-dreaded drug was offered a path to redemption. In the 1960s, an Israeli doctor observed that thalidomide alleviated pain and skin lesions in patients with leprosy. This chance observation led to further research, revealing the drug's potential in treating a range of other conditions. Today, thalidomide, under strict regulations and close monitoring, is used to treat certain types of cancer, skin diseases, and complications arising from HIV/AIDS. Lessons engraved in tragedy. The thalidomide tragedy serves as a stark reminder of the delicate balance between medical innovation and patient safety. It underscores the critical importance of rigorous scientific testing, ethical drug development, and stringent regulatory oversight. The lessons learned from this tragedy continue to shape the pharmaceutical landscape today. They highlight the need for continuous vigilance, transparency, and a patient-centric approach to drug development and regulation. The legacy of thalidomide reminds us that every new drug, no matter how promising, must be subject to thorough scrutiny and its potential benefits carefully weighed against its potential risks. The story of thalidomide is a complex tapestry woven from tragedy, resilience, and the indomitable spirit of scientific inquiry. The story of thalidomide is a powerful testament to the enduring human spirit, our capacity to learn from our mistakes, to seek redemption, and to emerge from darkness into the light of knowledge and progress. Don't forget to hit that subscribe button for more.